A woman from Nottinghamshire who suffers from a debilitating condition called POTS says she has to travel to London to be treated. That's because of a lack of doctors who can treat it in the East Midlands. Postural tachycardia syndrome affects the nervous system and can leave people disabled or even bedbound.
Cases of POTS have increased by a quarter since the COVID pandemic, but there are only a handful of specialists in the country, and the average waiting time for a diagnosis is 7 years, as Hannah Ludlow reports.
Emily Dakin from Edwalton in Nottinghamshire was diagnosed with POTS after a viral sinus infection when she was 16. She had dreams of becoming a doctor, but instead became the patient.
It affects my ability to walk. I have quite a lot of falls because of it. I struggle with very bad fatigue and headaches, migraines, dizziness, nausea. It's kind of a constant, and it makes standing upright just incredibly difficult.
When a healthy person stands up, to avoid blood dropping down into the limbs and abdomen, blood vessels contract and the heart rate increases slightly to maintain blood supply to the heart and brain. With POTS, this adjustment to standing doesn't work correctly, resulting in an excessive rise in heart rate and altered blood flow to the brain.
Okay, what are your symptoms?
Just the pins and needles in like the bottom half of my body, and the heart palpitations as well, and I feel a little bit lightheaded.
Alexandra is being tested for POTS using the lean test. Her heart rate and symptoms are measured every minute for 10 minutes. The results are then studied by a consultant who can diagnose POTS.
The whole field of autonomic dysfunction is not taught well in medical school. To be very honest, prior to COVID, I had no idea about the condition myself.
Professor Sivan says more research is needed into the link between viral infections and POTS.
The COVID infection, it does affect your autonomic nervous system in more than one way. Either it's a direct damage of the autonomic nervous system by the virus, but what we are also looking at is the virus it initiates an inflammatory response in the body, and then it produces what is called as autoantibodies. What needs to be done is to understand more in terms of how the autonomic nervous system gets damaged and whether we can do something about it.
A recent survey of POTS patients found 85% had difficulty accessing healthcare.
Patients are getting referred by their GP to secondary care service, and then when they get their letter back, it's saying, no, I'm sorry, you can't have an appointment, we don't see patients with POTS, or no, you're out of area, so we're not going to see you. And it seems absolutely barbaric to us.
Experts believe a cure for POTS could be on the horizon. Until then, those living with the condition want to see change.
I have a great clinic on the NHS in London, but I'm based in Nottingham, and that makes it quite inaccessible. I think it would be better if there was more nationwide clinics that were available to a lot of people, and also more understanding of medical professionals and how POTS can impact upon other conditions.
The government told ITV News it's working to revolutionise care for people with POTS by shifting care from hospitals to communities. Next month, the issues surrounding POTS will be debated in Parliament. It's hoped this recognition will be the first step towards real change. Hannah Ludlow, ITV News.